Do all mothers have equitable postpartum health outcomes? Are some mothers more at risk of dying or experiencing short or long-term health complications from pregnancy? It has recently come to my attention that there are disparities in maternal mortality and morbidity among Black mothers. I am here to bring awareness to this dire situation and to give a few facts and figures and suggest some things that can be done to bridge these disparities. If we continue to ignore this issue, then the disparities already faced by Black mothers will continue to grow, and more women will face severe complications and even death. If we can identify why these disparities exist and intervene, then we can extend equitable outcomes to Black mothers. Compared to other races, Black women have the fastest increase in maternal mortality, and in some cases it reaches 12 times higher than that of other races, according to Martin and Montague. Black mothers are 3 to 4 times more likely to die from childbirth or other complications, according to the CDC, and they are seeing the fastest increase in maternal mortality than any other racial or ethnic group in America. Does this disparity exist in other countries? The answer is no. Howell tells us Black maternal mortality is higher in the U.S. than any other country of comparable wealth, and we have similar Black maternal mortality rates as Mexico and Uzbekistan. Also, for every 100,000 live births, 44 Black mothers will die, compared to 13 white mothers and 14 mothers of other races. Any death is terrible, but the disparity in Black maternal mortality is apparent, according to Howell. Shocking, right? Well, 46.8% of Black mothers die from cardiovascular-related problems, compared to 40.9% of white mothers and 39.5% of Hispanic mothers. And the Government Accountability Office tells us that the COVID-19 pandemic worsened maternal health for every mother, but it was especially worse for Black mothers, increasing their maternal deaths to 68.9 out of every 100,000 live births. Not only do Black women suffer higher rates of maternal mortality, but they are also at an increased risk for morbidities associated with pregnancy. Black mothers are 2.1 times more likely to experience higher rates of morbidity, and these morbidities include pregnancy-induced hypertension, hemorrhage, and gestational diabetes, according to Howell. Howell also tells us healthcare professionals look for 17 comorbidities in pregnant women of any race, and of these 17, Black mothers were at risk for 11, and these include the asthma, hypertension, and diabetes, higher than any other race. So why do these disparities exist? One reason is because of some social determinants of health, such as lack of education and low socioeconomic status. These can contribute to poor nutrition. Kraft, Blackshear, and Kahn states that this increases the risk of complications such as diabetes and preeclampsia. Transportation barriers and lack of healthcare facilities in their community make it difficult to have proper prenatal and postpartum care. But race appears to be the biggest factor causing this disparity. Tina Solomon says it best when she says it's racism, not race, that is killing America's Black mothers and babies. Racism and unconscious biases have spilled over to our healthcare system. Doctors and patients don't have a good relationship. Healthcare professionals may let their unconscious biases cloud their judgment, and sometimes they just don't listen when Black mothers tell them something is wrong. Data from Solomon suggests that 50% of white medical professionals or white medical students thought that their Black patients had a different biology than other races, believing that their skin was thicker and their nerve endings were less sensitive. Unconscious biases can lead medical professionals to think that their Black patients are unworthy, poor, and uneducated. These views can lead medical professionals to delay treatment or even ignore complaints, according to Solomon. A prime example of this is the case of Shalon Irving. Solomon tells us that she was a Black, well-educated, affluent doctor working as an epidemiologist with the CDC. She died 3 weeks after giving birth due to complications of pregnancy-related high blood pressure. She was experiencing swelling and blood pressure fluctuations, but was told that these were normal when mentioned to her healthcare professionals. She lost her life due to lack of treatment and because her doctors didn't listen to her due to the structural racism and biases in our healthcare system. So how can we prevent Black maternal mortality and morbidity? According to Kraft, Blackshear, and Kahn, studies have shown that lack of access to healthcare is a barrier many Black mothers face, and the solution would be to expand Medicaid so that Black mothers would have insurance to ensure that they have the means to pay for prenatal and postpartum care. Kraft, Blackshear, and Kahn also state that increasing SNAP benefits is another solution to decrease the risk of mortality and morbidity. This increase would allow Black mothers to buy enough nutritious food to reduce the risk of preeclampsia and diabetes. We also need to ensure that there's access to health care, whether this entails expanding public transportation or opening more community clinics. This can also include broadening access to telehealth services and certified nurse midwives to make house calls or offer expanded services in hospital settings. And this is all according to Kraft, Blackshear, and Kahn. Kraft, Blackshear, and Kahn also suggest sensitivity training and training on the disparities Black mothers face to all healthcare professionals. And this could go a long way to closing the disparities faced by Black women for maternal mortality. To conclude, I have introduced you all to the disparities Black women face, and I've also offered some solutions, but I would like to leave you with something to think about. As a white mother that had a high-risk pregnancy, I was well taken care of. My healthcare team made sure to check for preeclampsia and other complications, and I had frequent testing to make sure my baby was healthy before he was born. I received great postpartum care too, making sure that my blood pressure was not elevated, I had no swelling or signs and symptoms of pregnancy-related complications. Would Shalon Irving be alive today if she had received the same care that I had? I would like to think that she would be, but we must ensure that all Black mothers receive equitable care to reduce maternal mortality and morbidity, and these suggestions are just a start. Thank you.